First, assemble the spacer and mask if required. Check if the inhaler is not expired or empty. Remove the inhaler cap. Hold the inhaler upright and shake well for 5 to 6 times. Then, insert the inhaler upright into the end of the spacer. If this is a new spacer, or if the spacer is being used for the first time after it's been washed, please prime the spacer by administering 10 inhaler puffs into the chamber. This will help coat the lining of the chamber to ensure that the intended medication reaches your child. If using a mask, place the mask over the mouth and nose, making sure they are covered with no gaps around the edges. When you are ready to administer the inhaler to your child, hold the spacer level and press down firmly on the canister once. To breathe in and out normally for 8 breaths, the movement of the valve in the chamber would indicate that a breath has been taken. Then, remove the spacer from the child's face. Remove the inhaler from the spacer. If more than one dose is needed, repeat the steps as shown. If a mask is not required, you may place the mouthpiece of the chamber between the child's teeth without biting and close the child's lips to form a good seal. Then, administer the inhaler by pressing down firmly on the canister once. Have the child breathe in and out normally for 8 breaths. Once this is done, you may remove the spacer from the child's mouth. Once you have administered all intended doses of the inhaler to your child, you may then remove the inhaler from the chamber, replace the cap on the inhaler, disassemble the spacer and mask, and then store away. Clean your spacer once a month or more frequently as instructed by a doctor or nurse. First, disassemble the removable parts of the spacer as recommended by the manufacturer. Then, add a few drops of liquid detergent into a basin of warm water. Soak the spacer parts in the warm water, and this should be done for 15 minutes. Air dry the parts overnight. Do not dry the spacer with a cloth or paper towel, as this can result in static on the inside of the spacer, which will make the medication stick to the sides and not reach your child. After washing the chamber, reassemble all parts and be sure to prime the chamber with 10 inhaler puffs before use. The spacers should be checked by your doctor, pharmacist, or nurse every 6 to 12 months to check the structure is intact and that the valve is working. If your doctor has recommended for you to receive your inhaler without using a chamber, please follow these steps. First, check that the inhaler is not expired or empty. Then, remove the inhaler cap and shake the inhaler 5 to 6 times. Then, breathe out gently to empty your lungs. Next, place the inhaler between your lips to form a good seal. Breathe in slowly and deeply while pressing down on the canister firmly. Then, hold your breath for 10 seconds. Next, breathe out gently. If more than one dose is required, repeat the steps as shown again.